Hi everyone, my name is Nadia Guerrero and today I'll be presenting Clostridioides difficile. So some characteristics of Clostridioides difficile. Its former name was Clostridium difficile and it was recently changed due to some discoveries that it was more closely related to the Peptostreptococcaceae family. It is also known as C. difficile, C. diff, or CDI, Clostridioides difficile infection. It's a gram-positive spore-forming rod and an obligate anaerobe. And these two conditions are really important in characterizing this bacteria because the spores that it forms, they survive in aerobic conditions, and our body is also aerobic. But then how does it proliferate in the body? So since it's an obligate anaerobe, it has to reach the areas that have the least amount of oxygen, and an area in the body that has the least amount of oxygen is a human colon. So this is how it proliferates there. And then when it's proliferating, it releases toxins A and toxins B, and these are the ones that in turn lead to the disease. So I'll talk about these a little bit later in the presentation. So when talking about C. difficile infection, it's also really important to consider that we have normal microbiota in the intestines. We talked about these a little bit in lecture. So they're bacteria that we have in the gastrointestinal tract. We have then more than quadrillionin microorganisms, and these are mutualistic because they're also providing us with health benefit. They're preventing us from harm of infectious bacteria by eating up all the nutrients that we have in the human colon, and then in turn, by eating up all these nutrients, the pathogenic bacteria won't have any nutrients to survive. So the C. difficile infection, it's caused by dysbiosis, which is a change in the normal microbiota that we have in the intestines. And this is caused by the overuse of broad-spectrum antibiotics. And in turn, it can lead to various different diseases such as irritable bowel syndrome or pseudomembranous colitis that is caused by C. diff. So how does C. diff enter and invade the body? So as I said before, the C. diff produces spores, and these spores are then injected via the fecal-oral route. So these spores are often found in fecal matter or on surfaces contaminated with feces. So for example, at the doctor's office, the thermometers that you have, or the beds where the patients are lying, or any surface that is contaminated with these feces from someone that has C. difficile. It's also found in animal GI tracts like of cows, pigs, reptiles, or birds, even soil or water, but there's limited evidence since most of the CDI infections are caused at hospital settings. So it's not airborne or droplet. And then once these spores germinate into the vegetative form in the intestines, they then cause a production of toxins A and toxins B that I was talking about. So we have toxin A, which is an enterotoxin, and toxin B, it's a cytotoxin. So what toxin A does, it leads to fluid accumulation in the intestines, and then in turn, this will cause the watery diarrhea. Then toxin B, it depolymerizes actin, which leads to cell death, and then this causes the formation of pseudomembranes. And these pseudomembranes, you can see them here in the picture. It's yellow patches that form on the lining of the intestines, and then in turn, this leads the colon to not be able to retain some of the fluid, and you have so much buildup, then it leads to the watery diarrhea. So the toxins are endocytosed. It also leads to cell death, necrosis of the epithelial cells, leads to inflammation. Then we have the colon damage and the production of pseudomembranes, which causes the pseudomembranous colitis. So who's at risk for contracting C. diff? So most of the time, if you're young and healthy, when you have C. diff, it'll live in your normal microbiota. So this is called colonization. Most of the time, you're not going to have any signs or symptoms because the C. diff is living in your normal microbiota, and the other microorganisms are eating up the nutrients that'll prevent it from proliferating and causing any harm. But however you are an asymptomatic transmission, it's possible that you can transmit it to someone else. So you should be really careful with those that are older than 65 years old. You should always wash your hands because there's a risk that you can transmit it to them, and those that are immunocompromised, and then these can develop a more severe infection. But however, the ones that are mostly at risk are those who have been using antibiotics such as clindamycin or fluoroquinolones, and they've also had exposure to this agent. There's also the people that use proton pump inhibitors such as Prozac, omeprazole, esomeprazole, the ones that are used to control stomach issues. Then also, as I said, being older than 65 or staying at a hospital or nursing home, since there's a lot of people that have these infections. And of course, if you've been exposed or have a previous infection with C. diff, you're greatly at risk. Okay, so some graphic images ahead. So some of the signs and the symptoms of CDI infection appear 5 to 10 days after the use of antibiotics, and the main hallmark of the infection, is watery and foul-smelling diarrhea, and you have it more than 3 times a day for more than a day typically. And then you're also thinking probably, so how am I going to differentiate this from antibiotic-induced diarrhea? So one of the symptoms or the signs that differentiates it from this diarrhea is the fever. So if you have fever, that's something you should look for when you have CDI. Also loss of appetite and dehydration. And then of course, if you know someone that's had CDI, or in the hospital there's a lot of CDI cases, this is when you'll also start to look and try to diagnose CDI. And when you have a severe infection, the diarrhea will be 10 to 15 times a day or even more, and it's also severe abdominal pain, weight loss, and you have blood and stool. And here in some of the pictures we can see the pseudomembranes and then the colon that is really inflamed. Here we also have an x-ray that shows the intestine is really inflamed as well. Okay, and there are some more graphic images ahead. So some complications that you can have from the CDI infection include dehydration, which in turn leads to kidney failure. You also have toxic megacolon, and this toxic megacolon is when the intestines become really inflamed, and it can also lead to other problems such as bowel perforation, which is when your intestine gets so inflamed that it can't retain any more feces and it will eventually explode. Then you also have sepsis, which is the infection that has spread to your blood, and then you also have death. So here we have some images. Here is an image of toxic megacolon. It appears that it's about to perforate. Then we have a picture here of how inflamed the megacolon can get. And then I also found a really interesting case of a 27-month-old that had severe pseudomembrane colitis due to the C. diff infection. It's a really rare case because typically most of the cases are in older adults or that are staying in nursing homes or hospitals, but this was a case that I found. So some treatment is to discontinue the antibiotics that were being used. Typically these antibiotics were being used for a previous infection. However, in this case we want to discontinue them because they were leading to the elimination of the microbiota in our intestines and causing the C. diff to proliferate. And it's funny because to treat C. diff, we actually have to use more antibiotics. We use vancomycin, fidaxomicin, and metronidazole for 10 days. Typically, vancomycin is the one that is preferred and not metronidazole because it's found that vancomycin is more effective against severe infection. So then this leads to the question, why should I take more antibiotics when I stop taking antibiotics? So you're taking more antibiotics to kill the Clostridioides difficile. This is because you want to stop the elimination of the normal microbiota, and you're taking these vancomycin, fidaxomicin, because these are the ones that cause the least harm to the other normal microbiota. You do want to eliminate the C. diff, which is also a bacteria and can only be killed by the antibiotics, but you don't want to kill all the other normal microbiota. Okay, and then there's also a really new and innovative treatment. We have fecal microbiota transplantation, which is basically you're taking stool from a healthy donor, mixing it with saline, and then inserting it into the affected patient. And typically you use it to prevent CDI from occurring again, because you can get it again. Well, I think it was 1 in 6 people will get it again. So you can use this method. It was first used over 1,000 years ago by a Chinese doctor in traditional medicine. He thought that by using fecal transplantation, it would help with those that have been having diarrhea or other symptoms. And the way that you can insert it now, it can be via oral capsules, a colonoscopy, a retention enema, or a nasojejunal or a nasojejunal tube. And the way that this works, you'll have your healthy donor stool, and it'll be inserted into your intestines, and by doing that, it'll help the normal microbiota proliferate. And then when you have an outside pathogen such as C. diff come and try to proliferate, it won't be able to, because you already have a abundant gut microbiota that'll be able to protect against the outside bacteria that can be a pathogen. So how are some of the ways that we can diagnose C. diff? So we have culturing the stool in anaerobic conditions. That's pretty difficult to do because it's hard to grow bacteria in conditions that are anaerobic without the proper supplies. We have toxin A and B enzyme immunoassay, glutamate dehydrogenase enzyme immunoassay sensitivity, and nucleic acid amplification tests. These NAAT tests are a little bit more difficult sometimes because of the time that it takes. And then I also found that you have some other different types of ways to diagnose. We have Cliff, the dog who sniffs C. diff. I found it really interesting because I was just looking through YouTube videos, and then I found this really interesting case. So this dog, dogs have better smell than humans, of course. So he was used to detect C. diff in various stool samples in hospital patients. And even though it was fairly accurate, but not as accurate as using other types of tests, it did help the patients get tested and diagnosed before developing severe infection. So this also brings up the question, can dogs be used in screening, and should they even be used? There's a lot of ethical concerns, such as the dog getting the C. diff infection or being able to transmit it to other patients. But however, it was a very different way to help diagnose it, and it was very useful for those that didn't even know they could have the Clostridioides difficile infection. And if anyone is interested in watching the video, here I have it. It's Cliff and C. diff smelling the diagnosis. Okay, so some of the numbers and prevention of C. diff. It's the most common cause of healthcare-associated infections or nosocomial infections in the U.S. We have more than 500,000 infections in the U.S. per year. Typically, most of these are caused by being in the hospital or in nursing homes. And as I said before, 1 in 6 people will have the recurrent infection in the following 2 to 8 weeks. And then, as in the mortality, 1 in 11 people over 65 years old die within a month. And it's also really interesting because the numbers are rising even for healthy adults. Well, not healthy, for young adults, and they have even surpassed the methicillin-resistant Staphylococcus aureus cases, MRSA. And some of the ways that we can prevent it, the best ways are using PPE, such as gloves and gowns, and the most important one is washing your hands instead of using alcohol sanitizers. And this is done because by using alcohol sanitizers, you're not killing the spores. You need to perform hand washing because this mechanical action will wash away the spores. And then also, if you have CDI infection, use a separate bathroom since you're having watery diarrhea and you don't want to infect others. Okay, and so here's a picture by someone forgetting to wash their hands. They can spread it to someone else, and then by the fecal oral route, it'll enter their GI tract.